I'm a pretty active person. I mean, I snow ski, I mountain bike, I run. I really wasn't looking forward to the prospect of not being able to do those types of things. It all started with the PSA test. It wasn't super high, but it was high enough that they wanted to recommend a biopsy. With the prostate cancer, the options aren't really appealing, and I was a little fearful of the side effects and ramifications.
We didn't make a decision very quickly. We were exploring different options, and Stanford had been recommended.
So we're going to come into it.
They were looking into kind of a new field of focal therapy, meaning treating just part of the gland instead of removing the entire gland, and with better outcomes and less negative side effects in terms of incontinence and erectile dysfunction and so forth. So that was appealing to me, obviously.
When I talk to patients, I will always start with the conventional treatment. Those can be excellent treatments for many men, particularly men with a large amount of aggressive type prostate cancer. But now we're able to offer high-intensity focused ultrasound, or HIFU.
Now that we've defined the region of treatment around...
Ultrasound energy is aimed from outside of the body and concentrated within a target deep inside the body. The technology is something akin to taking a magnifying lens and focusing sunlight onto a leaf. You can basically destroy the tissue that's at that target, and the surrounding structures are left intact. One thing that makes us pretty excited about is the merger of these two technologies, MRI and focused ultrasound. We can see the target on the MR scanner and then use those real-time images with the patient on the table to plan the treatment. We can see where we want to aim the energy, circle it, and tell it to aim right here.
This is ideally suited to a man with relatively small, intermediate grade prostate cancer that we can see on imaging. HIFU for prostate cancer is not offered in many places yet in the United States. What we have found with focal HIFU is lower rates of erectile dysfunction, lower rates of urinary incontinence, quicker recovery.
It's a pretty long procedure, but I remember when I woke up, it was like nothing happened. Ilana and I went out to dinner that night, no pain. It was amazing. When you're discharged, you have to have a catheter for the first 7 days. The day the catheter came out, I started running again. I mean, it was that easy. I'm just lucky enough to be on the forefront of the cutting-edge technology, which only a teaching hospital like Stanford can provide. For anybody who's had a cancer diagnosis, you appreciate the simple things, the runs with your dogs, the enjoying food, savoring that. Next year I turn 60. People tell me I look better than I did before. Who knows?